Hi, this is Mrs. Lewicki, and this is slide 2 of 4 in the voiceover PowerPoints on communication. So one of the important areas when we are looking at communicating with individuals is their level of development. Language and communication skills develop through stages. Infants and toddlers tend to use more nonverbal communication, crying. Maybe we use touch with them. Older children, we can use pictures adjacent to words. Adolescents and adults are more reliable verbal communicators. And older adults, we want to make sure we adjust our methods to the physical changes of aging, like they may be hearing impaired or visually impaired. Communication techniques to work with children and families include using play to allow children to use other symbols, drawing, painting, or other art forms, storytelling, taking turns adding to a story, putting words to pictures, using word games such as what if, read books with similar themes, then discuss, watch movies or videos, writing by older children to reflective journaling, develop meaning and gain a sense of control. And there are more in lifespan considerations on communicating with children and children and adolescents on page 2407 in your textbook. Gender, females and males communicate differently from an early age. Boys like to establish independence, negotiate status within the group, and girls seek confirmation. They want to minimize their differences, establish and reinforce intimacy. There are other socio-cultural characteristics of communication: culture, education, and economic level. Sometimes with culture, we talked about this in the previous slide presentation. Depending on the culture, they may not make eye contact. They may consider that a sign of disrespect versus trustworthiness. Touch, they may be, as North Americans, we consider that a caring and concern, where other cultures may consider it offensive. Education, their level of vocabulary and ability to read are also important characteristics for communication, because you need to they need to understand what you're trying to say, and sometimes if their education level isn't able to read what you're presenting, they may be too embarrassed to let you know, so they may be hiding that. So we want to also make sure they have access to written communication, email and computers, if that's the way that we're communicating with them. Some of the elderly do not have email or computers, and other people that are socioeconomically deprived may not have access to that either. Values and perceptions. Values are standards that influence behavior, and perceptions are your personal views of an event. So, for example, you and your sibling experienced the same Christmas morning in the same household, but you may perceive it differently. There's unique personality traits, and that values and experience affect your perception. You want to validate or correct perceptions as needed. Personal space is defined as the distance people prefer in interactions with others, and you know that that's going to vary depending on the individual. Proxemics is that an intimate distance is frequently used by nurses, and that's usually touching to 1.5 feet away. Personal distance is less, it's also frequently used by nurses, but it's less overwhelming to individuals, and it's 1.5 to 4 feet away. It's less overwhelming. Voice tones moderate. Body heat, smell is less noticeable. Handshake is okay. And social distance is 4 to 12 feet away. clear visual perception of the whole individual. You do need to increase eye contact and vocalizations loud enough to be overheard. Limited to seeing and hearing, and it's out of reach for touch, personal sharing of thoughts and feelings. And public distance is 12 to 15 feet away. Territoriality is space and things individuals consider as belonging to themselves. It can be marked off in a visible way, like curtains around a bed unit or walls of a private room. But you have to be careful, because sometimes if you remove a chair that belongs to the hospital and put it by another bed that for that patient's use, the individual may see that as invading their territory because it's their chair. Roles and relationships between communications between the sender and receiver. So nursing student and instructor, parent and child, choice of words, sentence structure, and so on vary from role to role. The first meeting versus a developed relationship. So you're going to be a little more formal in your first meeting with somebody. Informal with clients or colleagues versus formal with administrators. And the length of the relationship helps to determine the familiarity between the communicators. Environment can facilitate effective communication. Key factors include comfort and privacy. You don't want to have a personal conversation with a patient in the waiting room with an audience, perhaps. Or if the patient is experiencing a lot of pain, they're not going to hear their discharge instructions. So environment is key. Congruence, which means keeping it consistent. So congruent communication is that your verbal and your nonverbal aspects match. So if you're giving them bad news and you have a smile on your face and you're wearing a clown nose, it's incongruent for what the patient's hearing. It's seen by both nurses and clients. Incongruence means the sender's true meaning is in the body language, is how it's perceived. And you want to improve your nonverbal communication by relaxing, use gestures judiciously, practice, and get feedback on nonverbal communication skills from coworkers and classmates. It's a really good skill to have and to work on. Interpersonal attitudes convey beliefs, thoughts, and feelings, such as caring, warmth, respect, acceptance. They help to facilitate communication, where condescension, lack of interest, and coldness inhibit communication. So if the individual feels that you care about them, they're more likely to communicate with you. Effective nursing communication is significantly related to client satisfaction, and respect and civility is important. And when you're speaking to older adults, avoid elder speak. Elder speak, it can be demeaning and patronizing and is similar to baby talk. That's the end of slide PowerPoint 2.